Θέλουμε πρώτα να δώσουμε το λόγο στο κοινό, αν έχετε κάποια ερώτηση, κάποια τοποθέτηση.
Shall we make the first question?
Yes.
So, I have a question for the whole panel. I hope we all understood what we saw today. So, first of all, we had a presentation from Mr. Spatharou about what happens internationally on the field of clinical protocols. How are these implemented and how the digital world is enhanced through the use of clinical protocols, and how the clinical protocols improve the patient experience. Then we had the very, very good example of Cyprus, a newly established national healthcare service system, so within Europe, and this is food for thought about the effort that has been made there and the impact of the use of clinical protocols and the establishment of OAE, the organization that oversees the health services in Cyprus, has made to the whole of country. And Mr. Thηραίος presented the case of Greece. For me, the paradox that we had in this presentation that touches upon all the presenters. So feel free, each of you wants to respond. The question is based on Greece, so the audience that we have here, but it's tailored to everybody. So for me, the paradox is, we saw the example of Cyprus. They started from the establishment of clinical protocols, and then they go into establishing KPIs for the healthcare system. In Greece, we have done the opposite. We have started with ODP that introduces KPIs. Clinical protocols, as Mr. Thηραίος said, Dr. Thηραίος said, are not used for hospital patients. We have clinical protocols, but not for hospital patients. But the majority of the system here is around inpatients, around hospital patients. We do not have, unfortunately, in Greece, a strong primary care system. So that's the paradox that I saw in the presentation. I would like to understand whether this is good for us or how we can catch up with the rest of the countries, maybe with the use of technical support from NICE International, that has done an extremely good work through this conceptualization that basically is the type of effort to copy-paste in a way that we copy the good practice of NICE, but we implement them in the local setting, in Cyprus, for instance, or in Greece, that we would like to do in the future. So the floor is yours. That's the question that I have, so that we at ODP have a guidance today on how we could best proceed and what discussions we should have with the ministry. Anybody?
I think I haven't fitted that in. Does this work? Can you hear me?
Yes.
Okay, excellent. I think what I found very interesting about the Hugh presentation on NICE was how NICE's scope has changed over the years. So I guess the question is not should Greece be coping, specific things that have happened in the past, but more, what do we see as the biggest priority for Greece today? Because if indeed the biggest priority is, for example, standardizing quality in inpatient, then that will be the way forward with the ministry. That would be a good discussion to have. If the priority is, health equity, in fact, in the context of integrating different populations, higher levels of immigration, more underprivileged people left behind in different aspects of the service, then that leads to a different direction on where to create guidelines and even which pathologies to focus on. So I think it will be really interesting to take stock where we are today and what will be the 2-3 core priorities for Greece now. Therefore, what is it worth creating at least a common standard on, if only, and go further over time?
Yes, thank you for the questions. During the last decade and during the years of austerity, we have we tried to develop therapeutical protocols in order to develop a framework of good clinical practice and in the scope of the pharmaceutical expenditures, in order to have this scope, in order to develop these protocols. Of course, it's an adaptation of clinical guidelines in Δημιουργία this pathway. Of course, only for the outpatients, and it's we have to establish these protocols. And for inpatients, on the other hand, we'll also develop clinical audit in order to ensuring about the value of our performance for the patient and for the taxpayers.
If I could comment as well. I think one of the advantages, I think I was commenting about that before, one of the advantages of being one of the last countries implementing a national healthcare system enabled us to learn from everyone else in order to make, the necessary steps into securing what is needed for our healthcare system to be a successful one. So for the first couple of years, as I said, the first phase was in 2019. For the first couple of years, we were focusing all of our efforts in securing the availability of services, making sure that everything runs smoothly. But very shortly after that, we realized that in order to secure, as I said before, the quality of our services, and judging that we have the opportunity to do that because of our single IT system that enables us to have the access to the data, to be able to implement different procedures as part of that system, enabled us to look towards the way of establishing guidelines, of establishing metrics, and starting to going an extra step, not with referring to guidelines per se, but linking those metrics to reimbursement, which is also another way of ensuring that whatever you apply really is out there in the clinical space. So for us, I think it was very, very clear that a new system needs to, be following very secure and steady steps that others have followed before, in order not to make the same mistakes, but capitalize on the learnings that others have in order to ensure the relevant services and the quality of those in the system. So, yeah.
Yeah, I would like to address a question to Dr. Thηραίος, actually. So one important aspect of the contextualization of guidelines in Cyprus is that we have tried to involve all key stakeholders from step one. And most importantly, I think that the patient representation has really empowered them in this whole process. And this is a change of culture, I think. Mm-hmm. And medicine is now turning towards shared decision-making. So what is Greece's experience with patient representation in the process of your guidelines?
Yes, as already said in my presentation, we make a group from the academic field, from doctors in the field, and doctors outpatients of the hospital, and also with the collaboration of patients and the society of patients, in order to have the view of the patients and the response in order to use the performance of health workers in order to use these therapeutical protocols.
A final comment from my side before we close for today's session. On what I liked on Hugh's presentation, one of the last slides you mentioned about and as NICE, as you represent NICE International here, you mentioned about the respect that we need to have on others, on the work of others. And I would like to keep this and note this for the audience today, because this is the #1 rule that we have at ODP as well, as the organization that enforces, let's say, the change in the Greek healthcare system. So I'm really pleased to say that the leading organization internationally on improvement of healthcare is on the same page with us on that. When we want to enforce change, we do it, but through collaboration with all the stakeholders, the patients, the personnel in the hospitals that do all the hard work. And thank you for that, because it was a very, very good thing to see. Thank you. And thank everybody for the presentations.
Thank you.